from the Chamber of Commerce and from all of our members and viewers as well. So we're going to cover a few things today, go through some treatment, prevention, and then a lot of Q&A as well. We want our viewers to post questions in the comments, and then we will get to as many as we can. If we can't get to them, we'll try to follow up after and answer those questions for you. I know there's a lot of information and some misinformation as well floating around out there, so this is our chance to get some correct information out into the community. So Dr. Purdy, do you want to start off and just kind of tell us a little bit about what's going on in your world and maybe update us on some of the things your clinic is doing, specifically the e-visits, et cetera?
Yes, hello again, Dr. Aaron Purdy. Work at the Grimm Healthcare Urgent Care, as well as Dr. Johnson and our nurse practitioners. Obviously, those are very trying times, and we're trying to do everything that we can to mitigate and minimize the spread of this virus that is reportedly going to peak. They say in 3 weeks, 3 to 4 weeks, and so this is the purpose of the social distancing, the importance that people stay at home and not get other people sick. People that are coming to our clinic, we are able to test them specifically outside in their cars, sending these out through a new lab where we're getting results back within 48 hours. But people need to call ahead and make sure that we're not exposing healthcare providers as well, because they're, people on the front lines, EMS, people in the hospital, they need, limited exposure. So people that are mildly ill, mildly sick, can do fine at home. They should stay at home. They don't have to get tested.
Perfect. And Dr. Purdy, oh, sorry.
Whose dog was that?
I think he froze a little bit.
We lost his internet, yeah.
There we are. Dr. Purdy, can you tell us where people go to make an appointment for one of those e-visits?
Yeah, through our website, grimmhealth.com. I believe that's right. You can click and have an e-visit with a provider through computer and or phone, and we can discuss and treat an array of issues that you may have to keep you from having to get out of your house and expose other people and or put yourself at risk. So they can go to our website, click on the e-visit, and then it'll contact one of the many providers that we have that will, reach out and have a visit online so that we can address any needs that you might have. A lot of people have issues that need to be addressed other than just the coronavirus and people being ill, but things such as, their diabetes or their hypertension, things that we can help them out with over the phone. We can do that. And I think it's a really good resource, doing telehealth, which we can offer.
So, Dr. Johnson, will you cover some of the, I know we've heard a lot about some of the symptoms to look for, et cetera, but I think one of the things that I've heard you say before that I think was really helpful is what symptoms mean that you call your healthcare provider, what symptoms mean that you go to a clinic for an appointment versus an e-visit, and what symptoms means you need to go straight to the emergency room.
All right. Hello, everybody. I just wanted to thank y'all for having us on. We appreciate all the collaboration in the area too. I wanted to say that first. Dr. Purdy has been really helpful with me talking to local healthcare officials, Pat Martin and GMA and Graham Regional Medical Center. They've helped to collaborate and make sure that we're keeping up with the epidemiology of this and reporting our cases. Our website you can go to is grahamhealthcare.com. grahamhealth.org is our email addresses. So it is kind of confusing. The other thing that I wanted to point out too, Dr. Purdy was alluding to, is that you can actually make your regular appointments and call the clinic like you normally do, and they can set you up for a televisit where we call you directly. The provider of choice calls you directly. The other option is the e-visit, and the e-visit, it's just like doing FaceTime, but the Texas Medical Association has, limited the HIPAA or loosened the HIPAA restrictions that we normally have. So, we may be able to, FaceTime or do something of that nature, or see you as an e-visit if you have a rash or you have something you think that we need to look at. That's a good way to kind of get triaged and know whether or not you need to come to the doctor. So speaking of that, the things that are important, if you're sick and you're not running fever, you're having upper respiratory symptoms, cold, cough, congestion, sinus pressure, sore throat, it's probably best to try to treat that symptomatically right now. Okay? If you're running fevers, then you need to give us a call. So some people don't necessarily show signs of fever and could possibly have coronavirus. So in that instance, if you're sick, it's probably best to wear a mask and do your best to stay home if your symptoms are mild and self-quarantine. With the shelter-in-place order, the best thing to do is keep your distance. I told y'all this yesterday, that the way to treat this virus is just not to get it. So if you're having allergy concerns or congestion, sinus pressure, sneezing, sore throat, you feel like you've got the crud, it's probably best to try to stay home and treat it symptomatically. If you're running fevers, give us a call. If you're having a fever and a cough, most likely we're going to have you come in and evaluate you, or we'll at least try to get vital signs in the car, swab you, make sure that your oxygen isn't low. If you are struggling to breathe and running fevers, it's probably best to go to the hospital. They're more prepared to deal with this. They've got every hospital that I've been to, and I know GRMC as well, but I work at Faith Community Hospital and at Olney Hamilton Hospital. They've got a complete COVID protocol. So if you come in with fever and shortness of breath, they'll do all of the emergency preparedness, the PPE. I know Olney just invested in a pod to separate respiratory cases from the emergency room. So those are the kind of the three things. If you got cough and congestion, try to treat it at home. If you're running fevers, give your primary care provider a call. And if you're short of breath, struggling to breathe and running fever, you definitely need to be in the hospital.
Perfect. Dr. Purdy, we talked a little bit about some prevention, but can we go back through that again? Will you talk about some of the ways that, I think yesterday what you said was the best way to not get sick is to prevent yourself from getting sick, or something along those lines, which makes a ton of sense. So can you share with us what that looks like and how we do that? Dr. Johnson.
All right. Aaron was concerned about technical difficulties. He's in Archer City today. So yes, we got questions as, does everybody need to be wearing masks now? Does everyone need to be wearing gloves? And the problem in this country is we don't have enough to go around. There are medical providers in other states that are really getting hit hard with this that have no masks. They don't have isolation gowns. They don't have gloves. So prevention, hand washing, trying to keep your hands away from your face. I mean, I cannot do it. I find myself constantly rubbing my eyes or You know, I have an itch on the side of my face, and just trying to keep your hands away from your face and your nose. Um, if you're coughing, you should wear a mask. Okay, not so that you don't get coronavirus, but so that everyone else doesn't get what you have. Okay. It would be nice to wear gloves. I do think we have more gloves, and I haven't heard too many out there. So someone asked yesterday also if they go to the store, should they wash their clothes? You know, at some point there it gets to be an overkill. If you wash your clothes, I mean, you sat in your car, you're gonna wash your car, you drove your car into your garage, are you gonna clean out your garage? I mean, are you gonna clean every grocery item that you bought? If you want to do all those things and you have the ability to do it, then that's your prerogative, but it's not required. You know, some CDC recommendations do suggest that we wear gloves when we're dealing with washing clothes and washing, and I mean, this is, you know, your family's clothes. So maybe it's best to wear gloves when you go into the store and then throw those gloves away, you know, because you're touching the buggy and you're touching so many other things in there that you normally wouldn't touch. So those are good things for prevention. I think the other thing is they really want us to do our best to social distance. You know, I see people still huddled in groups, you know, and you got one person sick, it usually takes one sick person, or 1 out of 4 get infected, is kind of the data they're showing. So, you know, I mean, you see, even at our hospitals, I saw a group of nurses gathered together, and there was 6 or 7 of them, and they were all within 2 or 3 feet of each other, you know, talking about cases. And yes, you want to be HIPAA compliant, but at the same time, I mean, we're very vulnerable to this right now. There's no telling what we've been exposed to in the last several weeks. So, but let's just use common sense. I mean, I think that you can go overboard with a lot of this. I think that we need to do our best to heed the warnings that this is definitely here, that it's in Graham, it's in Young County, that coronavirus is here. The whole travel restrictions, that's probably not the primary source of spread anymore. It's probably community spread. That doesn't mean you need to go on a trip, okay? But regardless, if you look at the data, you look at what all the epidemiology says, it's time to be vigilant. I know we're only 2 weeks into this thing, and it seems like it's been 2 months already, but we've got at least another month of doing this and doing it right. And I know people are going to get stir crazy. I know this has caused economic hardship on people, and that's part of what we talked about yesterday. We all need to come together as a community and take care of each other.
Absolutely.
I answer your question kind of.
No, that was great. And I did want to note that actually, since we did talk about it yesterday, and I thought it was a really powerful statement, when we're talking about the social distancing and the shelter in place, and sometimes some of that can feel extreme, especially for our local businesses, who it does require a really considerable sacrifice for so many of them. And I know all of us are going to feel that at some point. We're all going to feel the pain of that, and it is a sacrifice. But I was really encouraged, and I thought it was a really powerful statement yesterday. We had or day before yesterday, sorry, we had a shop local meeting with our local retailers, and they really they are really sacrificing through this. And you know, sometimes it's easy to brush that off and not realize the extent of that sacrifice, but these are livelihoods we're talking about, and it's considerable. And on that call though, they were really really great, really positive about saying that their sacrifice is worth it if it saves one life. And I just thought that was such a great approach from them, and just shows how many of our local businesses and retailers care about our community overall, even before personal financial, situations and stress. And I hate it for them. I hate what they're having to go through. I hate it for all of our local businesses and organizations. But I do think that that sacrifice, at least I hope that sacrifice is going to prevent people from losing their lives, or hopefully prevent as many people from losing their lives. And I think when you look at it as a life or death situation, it becomes a lot more extreme, and that sacrifice becomes, menial compared to life and death. So anyway, I was really moved by that. I thought it was a really powerful statement, and it really showed off just how much our local retailers and really all of our businesses care about each other, which is nice.
Yeah, I'm impressed by that. I just think that we need to do our best. There's a lot of people suffering already, and communication's key. We need to get out there on all these social platforms and find out what is needed. And if you need help, contact us, and we can get you to somebody who can help. I know the pastoral alliances and Catholic charities and the chambers are all working together to provide as much help as possible. So, but on a healthcare note and perspective, I think that we need to know it's going to get worse before it gets better. And the biggest way to keep this from spreading is to stay home. I mean, with the shelter in place order, you need to stay home unless it's essential. So I don't know how much to believe, but the folks in China, they pretty much stayed in their house and came out once every 3 to 4 days to get groceries. They didn't go to work. Everything shut down. And I mean, we're a different nation. We're a democratic republic, and but we need to be smart enough to help ourselves. We're the nation that, we're very independent, we're free thinkers, but in this point, we need to listen. So, and because people are dying right now because people aren't listening. So, in New York, at one of the most prestigious hospitals they have, where the billionaires go to get their health care, they're deciding who lives and who dies, who gets ventilated and who doesn't. So, I mean, and that peak in New York should be here in the next week or two, but they're showing peaks here in Texas to be like in May. So I think we really need to do what we can so we flatten that peak, what we've been talking about. And I really think, you look at Dallas and what they did really quick, and that was a really good example for the entire area, because that's where the majority of our population is centered. So.
For sure. Okay, we also had some questions regarding treatment of the virus. And so I guess, Dr. Purdy, is your internet connection going strong at the moment?
I mean, you can tell me if you can, I'm reading what I'm saying, and it's relatively clear.
Looks good. So can you walk us through let's start with general, how you would treat somebody who does have the virus, and then move on to, I have some specific questions regarding potential medical treatments as well, but let's start.
So the vast majority of cases, 90%, if not more, I mean, people are going to do okay. They're going to do well just by taking Tylenol and staying hydrated and being healthy. And there are medications that are being talked about, but they're using them in the hospitals. There's no medication that we could or should prescribe you if you are at home. The medications they're talking about specifically your azithromycin, your hydroxychloroquine. Those are hospital medications, and they need to be saved for.
Jeremy, do you want to, I mean, Dr. Johnson, sorry, do you want to pick up where Dr. Purdy?
Yeah, no, I think he's saying to save those medicines for the hospital. You know, the director at NIH, Dr. Fauci, says still azithromycin, hydroxychloroquine, you know, Plaquenil is not approved yet for treatment. So I really think that, you know, if you're sick and you're having respiratory distress, then that's the time to be treated with that, because we've already, you know, the pharmacies don't have hydroxychloroquine, which is something that, you know, a month ago I could have got a prescription, and I probably did give a prescription to several people for rheumatoid arthritis and other treatments that it's used for as an immunosuppressant. But now you can't get it. So we still have enough azithromycin out there for treatment in clinic. If you've got a, you know, acute bronchitis, or you're allergic to penicillin, you have strep throat, you can still get it in a clinic fashion. But we really want to kind of preserve our medicines, because, you know, it seemed like the medical community in China felt like that was working really well, and they did a couple of studies that showed that it was doing well, and it helped people that were sick. So that's the reason why I want to preserve that. But he was right. The primary treatment is, you know, cough medicine. They say to kind of hold off on the steroids and Motrin. So because that can cause worsening of symptoms and disease process. So,
so for pain relief, Tylenol, not Advil, Motrin, ibuprofen, right?
Yeah.
Just to be clear. Okay.
Yeah.
And the azithromycin, is that an antibiotic, Dr. Johnson?
Yes.
So, but antibiotics aren't typically used to treat viruses, correct?
Yeah, they're used to treat bacteria, but they found there's a post-viral spectrum. I was reading a little bit about it and what they feel like mediates it. And it's got to do with a lot of inflammatory cells in your body. There's millions. So, but it seems like it really works, you know. Plaquenil is an anti-malaria drug. So, you know, and malaria is, you know, mosquito-borne illness. And so, I mean, and they use a lot of medicines for off-label uses, and they find out that somebody was taking azithromycin and Plaquenil did really well. So, sorry, gotta itch my face again.
Gotcha. Well, I guess I just want to say, and I think a lot of people out there would agree with me, but I'm continually impressed with our medical community here in Graham, and really overall, because it's incredible to me how quickly all of the doctors and all of the medical employees just jump into action and try to find solutions and try to find treatments and try to find ways to test, try to find ways to minimize exposure. I just think it's incredible. It's a really good example for the rest of us, for everybody to be, you know, to adapt and to stay flexible and to think outside the box. I know that's hard, and it's probably been pretty chaotic for you all, but I just think it's also kind of a great example of an American business that, you know, goes out there and tackles a problem as quickly and as capable as possible. So anyway, thank you from us at the Chamber, and thank you personally as well. We appreciate you guys very much, and your whole team at Graham Healthcare Urgent Care. Lisa, do we have any additional questions?
No, we haven't had any.
Can you hear me okay?
Yeah, there you are.
So one thing I wanted to reiterate on patients who are sick: if you are very ill, And we don't want to overutilize EMS services. If you just have a fever, if you just have a cough, we don't need to be calling 911 because they're going to be stretched thin, especially over the next 3 to 4 or 5 weeks. So make sure you reach out to your healthcare provider if it's not a true emergency, because they are going to be spread thin and overwhelmed, and they need to know, not only the hospitals, the doctor's offices, EMS, if you have a fever, if you have a cough, if you might have this virus, they need to know before interacting with you so that they can protect themselves. We have to do everything that we can to protect our healthcare workers, because all over the country and in other parts of the world, there's a shortage of healthcare workers because they're getting sick. So that's just something I wanted to add.
For sure. Well, and kind of on that note, Dr. Purdy, what can we do as a community just to appreciate you all and say thank you? Like, what are some ways that we can help you? Help all of our doctors and nurses and medical staff here in Graham.
I mean, I would adhere to the current, guidelines from Abbott and Young County with shelter in place, stay at home, do your best not to get sick. That's what's going to help us the most. Like I said, my heart goes out to the people that are affected by this economically, financially. And these are tough times, unprecedented times. We haven't ever gone through this in our generation. So everybody just needs to band together and help each other,
Band together figuratively, though, right?
Minimize the spread. Yeah.
Did you hear me, Dr. Purdy?
What'd you say?
I said band together figuratively, though, right?
Correct. Oh, yeah, absolutely.
Don't actually band together. Okay,
or
great.
with your
Well,
PPE on.
Yeah. First get suited up, then band together.
Mental health is important right now. I mean, a lot of people are anxious. A lot of people don't know how to deal with their stress. I think it's important. I think the Graham Psychological Associates are doing telehealth as well, televisits to help people with their anxieties and their stress. So you can reach out to them. Maybe there are ways that they can help people deal with, your kids at home, having to stay at home, not working, the financial stress. We need to make sure that we're taking care of our mental health, figuring out creative ways to exercise or work out at home, be outdoors if you can, but not, amongst other people. But trying to keep your spirits up, during these times is very important as well.
Absolutely. I think this is something that either you've said previously or said yesterday, but that, the shelter in place and the social distancing definitely does not limit us from going outdoors in our own yards, our backyards, etc., to get some sunlight and get some fresh air and get some exercise if possible. As long as we're not socializing with neighbors and things like that, that's probably a very healthy option for many of us. And sunlight, I think, is key to just making sure we're taking care of ourselves and feeling okay mentally.
And utilize these platforms to communicate with your loved ones, Skype and FaceTime with your grandparents. We don't need to be visiting our grandparents right now. They're the most vulnerable. We don't need to be going to the nursing homes to visit, them. We figure out ways through technology and Facebook and Skype to communicate and show your love for your loved ones without putting them at risk or exposing them.
For sure. Well, I have two more things that I just want to note quickly. One is I want to say thank you to Pete Clark with the movie store for helping us get this set up today, since we did experience some major technical difficulties yesterday. And I also just want to note that we're all learning and adapting and evolving as businesses and people. And so I think hopefully this will be the last technical difficulty we experience for a while, but I would say that's unlikely because we are trying to get creative and adapt to a new way of doing business. So anyway, hopefully many of our viewers will sympathize a little with us on that, and I appreciate everyone's flexibility. The other thing I want to note is, Dr. Purdy, we've had quite a few comments about your beard.
Yeah.
Lack of.
I get comments about that daily, and working in the hospital, my N95 respirator mask would not fit or seal with my previous beard. So I did my very small, tiny sacrifice to protect myself and to protect other people so that I can fit and wear my N95 respirator.
Maybe we need a Facebook poll on who looks the most different without their beard, Enoch Espinoza or Dr. Purdy. It's one way to, keep people smiling, right?
Yeah, the beard will be back someday.
Yeah, beard goes back. I actually don't think I ever realized how much you look like Sophia until you lost the beard. It's incredible. I mean that as a compliment, but I'm just saying.
We need to get the previous. We did a Relay for Life charity event, and he, shaved it off smooth, and so he's got a little stubble there. I can't even grow that. So, but
a lot of beard envy going on, I see.
Krista, we want to tell you we appreciate it a lot. Chamber reaching out to us and having us on. So, and I think it'd be a good thing to just go around the medical community and get reactions from all of us. So
for sure,
we'll be listening.
And we may need to do this more often as this evolves, because this will be an evolving weekly issue and problem. And
absolutely,
things will escalate, things can change, and it might be good to possibly do these, on a weekly basis.
For sure.
With different individuals to update the community and to stress the importance of, that this is serious and we need to take it serious.
Absolutely. Yes. And that is definitely our plan, is to do at least one a week focused on, kind of healthcare, medical related. And then we also have one coming up on tomorrow, actually at 10 a.m. with some of our local bankers. So I want to encourage everyone to tune into that. There's a lot of information going around about the new SBA loans that are out and the Paycheck Protection Program. And that's updating literally daily with more information or new information because it's new. And like you said, these are unprecedented times. So we're learning as we go in a lot of ways, but we wanted to get as much information out as we could, because we want those businesses who are suffering, who are facing challenges, to take advantage of some of those relief programs and funding that is available to them. So we're going to be doing one tomorrow at 10 a.m. and it'll be streamed Facebook Live again, so people can watch that with us, comment, ask questions, etc. And we're going to have Barry Gober and Brant Lundgren with First State Bank and Glenn McGee with Sierra Bank on to answer some of those questions and get some of that information out. So we appreciate you guys very much, and please let us know what we can do to support you. I know you are working tirelessly, and you're also taking a big risk every day. All of our essential employees in Graham are right now. So thank you from the bottom of our hearts. We appreciate you and what you do for our community.
Thank y'all. Stay safe.
Bye,
Wash
guys.
your hands.
Thank you.
Wash your face.
Wash everything.
Brush your teeth.